said, oh, that's a good comparison sample.
For the urine samples, we did the same thing that everybody else here did. We did the first morning void. So after we had been here for 2 days, we took a urine sample the next morning.
Where were you the night prior to taking the first morning void?
We were in,
Thank you. You're not here in ditch breathing the same air that Mayor Tillman and the commissioners are. Why not come in here, set up a mobile home down here, your RV y'all are so fancy with, and live out here for a month? And come tell us that your eyes don't burn, you know, you can't breathe, and that everybody around you is sick, and you go to the hospital and the doctors say there's nothing that we can find.
well, the best information we have is the blood data, and the blood samples we collected from our staff were collected at the end of our workday, which is usually about a 10-hour workday. So we were here the whole time during the day.
This young lady back here is 24/7.
I understand
Well,
that.
other than a couple hours of trip.
I thought you said that you took it in first thing in the morning. That
The
you did
urine
just what we
samples.
did.
The urine samples, the
Okay,
blood
took the blood
samples
samples.
at the end of the day.
Yes, there's only 14 minutes with water, that's everything.
Okay, the other concern I have.
I'm sorry, could you come up to the mic so everyone can hear?
Our children, they start getting sick, they start experiencing the itchy eyes, they can't breathe, they have sore throat, they have headaches, we take them to the doctor, it comes back that it's due to this. What coverage are they gonna get? What guarantee are we gonna get that our children are going to be okay? I mean, you're saying that it's okay, but obviously it's not, because you have this lady back here who's deathly sick, who's lived out here from day one. So, what's our children gonna be in 6 years from now? 10 years from now?
What we're saying is based on the data we collected. These are our results.
But that data's old.
This data is only a couple months old.
Well, but you're comparing it to data that's
That's the most complete and accurate data that we have.
7 years old. So,
When data is collected on a large scale like that, it takes quite a long time for the data to get verified.
okay, and when it does get verified and everything's up to date, and it comes back that these kids need to be tested, are y'all gonna come out here and test the kids as well?
We're working with the TCQ to look at the air monitor that's been installed in the area. If it looks like there's seasonal variations or something weird that looks like it's going on, and we can identify additional funding, we are more than willing to come back out here.
So it all boils down still to money, additional funding. And our kids are left out. I mean, we are here to be their advocates and speak for them. They can't, it's unfair to them. They're minors. So you're telling me it's still a money issue when it comes to our kids?
I'm
That's
saying
not
we can
right.
we can only do what we have funds to do.
Well, that's not right.
Here it says we have billions in surplus.
Well, it hasn't trickled down to our office yet. We were cut by a large percentage.
It's not going to. It's never going to, because it's going to come back that our kids are going to get health risk, and they're not going to be responsible for them.
Does anybody else have any questions?
I have a question.
Can we get? Okay, we'll let her go. I'll have Commissioner Cisco.
Do y'all have a graph of the age comparisons and the female to male comparisons of these?
No, we just looked at the residents as a whole, the population as a whole.
You didn't look at the ages of,
No, this was not a scientific or an epidemiology study. This was a public health exposure investigation to find
okay, so
out.
then my question then is, what was the age range?
It was adults, so anyone over the 18 could be included. I do not remember how old our oldest person was.
And how many of these were females and how many were males?
I can't remember off the top of my head, but we had a large mix of both of them. We were looking at the general public health here.
Commissioner, can we let
Yes.
Okay. Dr. Bradford, is it true that people, let's say children, that have smaller bodies than adults, when they're exposed, that they will show higher levels of a toxin than an adult?
It's possible. It depends on how much the child was exposed to.
And will they have those toxin levels higher for a longer period of time than someone like an adult with a larger body, a higher respiration rate, possibly a higher metabolism than a child?
It really depends on how much they are exposed to, how often, and how long.
But
All of those things come together to determine.
everything being equal, a small body of a child and an adult, everything being equal, exposure time, the concentration, same area, same place, same time period, won't a child with a smaller body, you as a doctor, have and show much higher toxin levels?
In general, children are usually more susceptible to toxics, but I am not sure if they would have higher levels. As we said previously, we don't have information about levels of these in the general population, so I don't know how their levels would relate, what the actual biological levels would relate to. Yes, they are usually more susceptible, so regarding health effects, they're usually more susceptible to chemicals in the environment. But I don't know how the levels would relate to biological levels.
Okay, thank you. Just one last question. Why were we compared to anything? Why didn't you come out here, do an evaluation of these individuals, and test these people and give us a report saying, yes, we found these toxins in their blood and their urine, and these people tested positive for these levels? Why did we have to whitewash this with some 95 percentile broad brush? And even that, obviously, by some of your slides, didn't even cover all the dirt. Why couldn't we just get an honest, forthright report that said, okay, the state of Texas came out here, tested these people, and this is what we found?
And we did present that information. We have in there exactly what we found. All the information, all the data that we were provided is in that report. We also provided a frame of reference, put it into context with, this is what we found here, but this is what we would expect to find in other areas of the United States. We're trying to help y'all figure out, if your exposures are higher, what can we help you do to reduce those exposures?
And your recommendations are don't eat mothballs or toilet deodorant biscuits, and don't ride in vehicles. Don't gas up your car.
We were just trying to figure out some possible explanations. The mothball, that compound, that's the only thing that we found that it could possibly do. But we admitted we
Seriously,
don't
doctor,
know.
seriously. How many times in your report do your people come out here, you yourself, telling us, oh yeah, there's some strong odors here. You people, yeah, y'all got an air quality problem here. But nowhere in your report, as a matter of fact, your conclusions run swiftly the opposite direction. You've heard from our citizens, I'll rest my case.
It's true, we did know the odors out here, but just because you're smelling something doesn't mean that it's a level that's going to cause adverse health effects.
Why, certainly
Smells are
not.
not directly related to
Well,
adverse
would
health
that
effects.
mean maybe there is something there though? Smell it?
Yeah, it's possible.
And so in other words, at least we know there's something there. Y'all just don't have a clue what it is.
Well, and that's why we're really happy to see that the TCQ put in the air monitor so we can see what's going on.
I think my lovely wife has a question. My lovely wife, please. This is my wife, everybody.
I'm Tiffany Solomon.
Dr. Tillman as well.
Dr. Tiffany Tillman.
All right, animal. But there was a question about whether the environmental situation could have influenced the test results that you had. I thought it was really interesting that you guys came out when it was really, really cold, the colder part of the year.